Theda, could you please talk about the different mental health conditions that occur with long COVID and what symptoms doctors and long COVID sufferers should look out for?
Yeah, so there's a lot, obviously, but I think things I most commonly see are depression, anxiety, symptoms of medical trauma or PTSD, and kind of sleep disorders and then cognitive issues. Those are sort of the top things that people tend to come in. And it's sort of complicated, right? Because with the depression, it can be a couple different things depending on how severe their illness was, depending on their medical comorbidities. Their depression may be a combination of like the physiologic impact of
Mm,
the illness combined with, as I mentioned before, the psychological sequela. So what is it like to have gone from someone who was super functional, super active, because I'm in Colorado, right, to someone who could barely get out of bed? And there's a lot of obviously emotional toll of that. And so we can kind of see that mix, or anxiety about getting ill again. Or if they were someone who was very ill and was in the hospital, in the ICU, fear of dying, again, if they get sick. And then I mentioned medical trauma, and that was very true, especially in the early waves when patients first started coming to me, just being in the hospital and not knowing, right? Because like seeing everything in the news about how there's this new novel disease that no one knows how to treat and people are dying from it. And so many people were highly traumatized by that, or just even if they were receiving excellent medical care, it's really scary to be in the ICU or be in the ER. And so those are some of the big things. And obviously, like brain fog, which is something that straddles multiple specialties, kind of neurologic, psychiatric. And so that one is, I'm lumping it in this question of mental health, but actually it's arguably larger, kind of more comprehensive than that. But we know that many mental health symptoms and conditions can worsen cognitive functioning. So that's part of the evaluation I do too, is try to figure out how do we optimize all parts of your care to try to improve some of the symptoms that are just going to take a while to get better.